Hi there, it's David here from My Physio SA. I'm one of the partner physios, and I'm here today and we're chatting all about feet, and we've got a special guest, Dr David Worsley. He's an orthopaedic surgeon, and we're here at Stirling Hospital where he consults and operates out of. So we've got a lot of questions about feet today. So could you get started by explaining what are the most common things that people come in with, what problems with their feet, why they need to see a specialist?
Yeah. So, breaking it down, most people have problems with their feet that they either have pain in their foot, or we break it up into the area that is sort of in three main regions of the foot. So we talk about the forefoot, which is sort of the toe area. We talk about the midfoot, which is this sort of region here, and then we talk about the hindfoot, which is more the heel and the ankle bones. So they're sort of the main areas that people experience pains. And then the other reason that people commonly want to come and see a foot and ankle specialist is that they're worried about the shape of their foot. Okay. So they've noticed either over time or perhaps they've had it a long time that the shape of their foot has changed. Yep. And that they can't get into their shoes properly anymore, okay. Or that they're just struggling with footwear, wearing it out abnormally, and have tried lots of things that quite often they've seen their physio for a long time, or they've been seeing their podiatrist for a long time, and that they've had the suggestion from their GP or the suggestion from their podiatrist or physio that they should seek further treatment. So as a surgeon, obviously I'm biased, I love to operate. However, we're just in the offering options, and so if you come and see me, I'm not necessarily going to operate on you straight away. We're going to have a chat about your problem, and there might be some solutions that haven't been thought of, and so it's just another opinion on how we could help you out with your problem.
Okay. So what are the most common problems that you would typically see?
So if we work through the foot, the most common forefoot problem that I would see, and most people are aware of, is the bunion. And that's where your big toe starts to go like across, and invariably it rubs on the shoe. It's much more classic in ladies, and particularly classically it's a problem with wearing high heels, and that is often the driver as to why people want to come and see me, that they love their shoes and they can't get into them happily anymore, and also that they say, my foot looks a bit like grandma's look now, and I remember that she had it. So it's a hereditary condition and it develops over time, so that's a classic. And also too, similarly in the same joint, which is this joint here, the first metatarsal phalangeal joint, is that it can quite commonly get arthritic, and so you get quite a lot of pain through this joint here, also with a little bit of deformity. Midfoot conditions is generally arthritis, that there's pain through the midfoot, that when you're walking there's a lot of pain, and particularly on rotation, that you just find people are finding it very uncomfortable in their shoes. And then into the hindfoot, very commonly again is arthritis. There's the joint below the ankle, which is called the subtalar joint. It can get arthritic as part of getting older, or that post-traumatically, and then ankle commonly can have arthritis in it as well. So people just find that over time their pain has been increasing. They've been tried lots of things, and that they've reached a point they just can't put up with it anymore. Particularly for the deformity stuff, such as the bunion, is that we talk about in foot surgery, we talk about you can either change the shoe, which you've usually tried, or we can change the foot, and that's what I can offer. The other really common conditions that we see are Achilles tendonitis. It's another unfortunate problem of having some birthdays. It gets a little bit sore behind, and lots of people have tight calves, particularly ladies wearing high heel shoes, but there's plenty of blokes out there that have tight calves too. And David would have spent a lot of time as a physiotherapist stretching for people, but it can be a bit recalcitrant, and there are options available to help that out. The other classic condition that I see acutely is the Achilles tendon rupture, which, to be honest, that's the disease I'm afraid of having myself, being a slightly unfit male who thinks his sporting career is not over, that they can rupture, and it's a very debilitating injury. And then the other common injuries that I treat are fracture surgery, so ankle fractures are very, very common, ankle sprains, and ankle instability. So ankle instability can come as part of recurrent ankle sprains, and that despite having great functional physiotherapy, that they can still feel unstable, and then for consideration of an ankle reconstruction.
So what if someone has one of those persistent problems that's not getting better and they come and see you? What would they expect on their first visit to see you? Sort of what sort of tests would you do and what would you cover?
Yeah, so first it's developing an understanding of what your problem is. So we sit and have a chat about the symptoms that you've been experiencing, the things that you've trialled already, who you've seen and what they've suggested, and what response you've had to that. So, as I mentioned before, whilst I do love to operate, we do like to try and maximise what we call non-operative treatment beforehand, that there might be some little tips and tricks that we can throw in there to help with your problem. Then a thorough examination of your foot and ankle. Many of the problems in the foot are associated with having a tight calf as well, so there's a few things that we do to make sure that it's not necessarily coming from your foot, but it could be coming from higher up. And then particularly too, as I have an interest in the entire lower limb, is that we have a look at your knee and your hip, and in particular your spine, as some of the pains that you could be experiencing in your foot can be coming from your spine. Then test-wise, we tailor, your tests to what your problem is. Classic old x-rays. It's important that you have your x-rays taken standing up, because the foot is designed to be walked on, obviously, and so we need to see on x-ray what your foot's doing under load. So if you've got your foot up in the air, it's not going to be doing the same thing on x-rays when it's on a load. So it's really critical that those x-rays, so if you've already had x-rays taken and they're not weight bearing, I do get another set of x-rays, so don't be perturbed by that. Then depending on what the condition is, you might need some MRI to further investigate the soft tissues. MRI is a fantastic test to look at soft tissues, and the foot's a very complex structure and has a lot of tendons and joints around it, so depending on your problem, to look for that. Or it might be in the form of a CAT scan, which is a great test for looking at the bones. So the tests are somewhat based on whether I think your problem is more soft tissue based or whether it's more bony based. And the x-rays then too are also, sometimes the problem is really obvious what it is, and that the tests are for planning for an operation. So I sort of relate to it that when you go on a treasure hunt, you want a map.
Definitely. So if someone does opt for surgery and you recommend it, sort of recovery periods, what should people expect after having typical surgery to do with bunions or arthritis or something that sort of changes the structure of your foot a bit?
The biggest thing people need to know about foot surgery in particular is swelling. Because surgery is essentially controlled trauma. There's an increase in blood flow to your foot to help heal that trauma. We walk around on our feet, so the blood flows down to the bottom and it stays down there. We're coming into the warmer weather, thankfully, and that increases the blood flow and they swell. And also too, often after foot surgery you're in a splint or a brace and you're not walking normally. So it means that the pumping action of your calf muscle, which normally pumps the blood back up the leg, isn't functioning normally, and therefore it swells again. So typically after foot surgery you can experience swelling for up to 9 to 12 months. It's not big and puffy, but you will notice it, and that's important to know, so that you don't get too worried about it. Also, depending on what you've had done, again, being in the brace and splints means that it can take an extensive period of physiotherapy afterwards to regain your strength and your range of motion. And a good guide to the amount of time that it takes is usually double the period of time that you spend in a splint. So if you're in a moon boot for 6 weeks, you can expect that it's going to take about another 3 months after you come out of the boot to regain your strength and motion. So it is a very frustrating period, but if you get the result and you get rid of your pains and you get rid of the deformity that you have, it's well and truly worth it.
Well, thanks for that. You summarised feet really well for us and gave us lots of good, valuable information. So Dr Worsley is also a surgeon who does hip joint replacements for the hip and knee. You do knee surgery, including ACL reconstructions. And then, as we talked about, foot and ankle, so that's sort of with fractures or just persistent problems that are giving you issues with walking, jogging, sporting stuff, whatever is limiting your life and you want to get back to do. So I appreciate your time today. Thank you.
Thank you, David.